So today we're going to start off with a lovely session. We're going to be presenting the nursing home paper. So we're first going to have Mary Cunningham speak on behalf of Seán Mackell. Mary Cunningham will be presenting the paper that was commissioned by the Irish Dementia Working Group on nursing homes. Seán Mackell, her partner, is now a resident in a nursing home. He was the former chair of the Irish Dementia Working Group. And Helen is going to be speaking after that. She's a global dementia ambassador, former chair and currently vice chair of the Irish Dementia Working Group, and also a former chairperson of the European Working Group of People with Dementia. And she's its nominee to the board of Alzheimer Board, which she just retired from last year. So now I'm going to turn it over to Mary.
Hello, thank you very much, Kim, and good morning, everybody. And thank you for giving me the opportunity to speak to you today. As Kim says, my name is Mary Cunningham, and I'm here today representing my lovely husband, Seán Mackell, who was diagnosed with Alzheimer's in November 2018 when he was 65. Seán was the General Secretary of a trade union, and he put the skills he had to good use when he joined the Irish Dementia Working Group in the Alzheimer's Society of Ireland. Sorry, just looking at his photograph. Seán quickly became chair because he did like to be in charge of things both at work and at home. Seán loved the work of the Irish Dementia Working Group and provided him and the other members with lots of opportunities to engage with policymakers, academics, universities, sports bodies, arts institutions, and public bodies, including Transport for Ireland and the media. And Seán was up for every single opportunity that was presented to him. And then, of course, COVID hit. Whilst the Alzheimer's Society pivoted very quickly to continue meetings online, the social interaction and the engagement was not the same. We were all impacted by the isolation from family, friends, and neighbours, and of course, the fear of getting COVID and the implications of that, when we believed that if you caught COVID, the likelihood was you were going to die. Against the backdrop of the pandemic, Seán and members of the Irish Dementia Working Group became increasingly concerned about people living with dementia in nursing homes during COVID-19. They wanted to be a voice for the voiceless and advocate for those living with dementia whose dementia had progressed to a point where they require long-term care. And we believe that this policy paper helps to shine a light on their lives. They're passionate about people living with dementia being rights holders. And as Seán said, everyone in the world is entitled to their human rights. However, many need support to exercise those rights and to ensure that those rights are protected. Ireland's track record regarding the protection of rights of the most vulnerable has been poor. And this is also evident for people living with dementia. Policy responses have at best been reactive rather than proactive, and usually responding to the latest scandal. The deaths of so many people living in nursing homes in the early stages of the pandemic is the most unimaginable tragedy. And it did appear that there was an attitude of out of sight, out of mind. The report highlights the importance of a sense of self-worth and self-esteem, the right to agency, power, and control, and the need for people living with dementia to be supported to lead a more normal life. It emphasises the urgent need for a human rights-based approach to care and the need for all stakeholders to be trained and aware of rights-based approaches. It calls for a more open and transparent approach to making and addressing complaints without fear of repercussions. The report stresses that safeguarding is everybody's business, and Seán is proud that the Irish Dementia Working Group made it their business. The lives of those who survived the pandemic was also very seriously impacted, as they were denied access to family and friends, the lifeline for all of us during difficult times. And very sadly, while Seán survived the pandemic, his life and mine has changed completely. In May 2022, Seán became very unwell with dementia-related psychosis. This led to him being sectioned under the mental health order, and he spent the next 6 months in a psychiatric unit. By July 2022, he was no longer able to walk or stand, and in November 2022, he was assessed as requiring 24/7 dementia nursing care. He moved into a local nursing home on the 2nd of November 2022. Little did he realise that as he was driving this agenda, he was driving it as much for himself as for other people living with dementia. It is so important that staff in nursing homes are trained appropriately. I remember vividly the discussions in the Irish Dementia Working Group, where there was a strong view from some members that there was no need to state in the paper that there was a need for training for staff in nursing homes, as it should be taken as read. I know firsthand that it absolutely cannot be taken as read, that all staff in nursing homes have received rights-based dementia training. In fact, I would wonder if they've all received dementia training, never mind rights-based dementia training, that focuses on facilitating voice and cognitive support, as well as care and risk management. I am incredibly grateful that Seán is well cared for in the nursing home, and I see lots of love and kindness every single day. However, love and kindness is not enough. Residents in nursing homes have rights and agency. They need support to ensure that their voice is facilitated. And I know that while Seán's vocabulary is very significantly impacted, I can still communicate with him, and he's very clear about what he likes and doesn't like, including who he wants to and who he doesn't want to visit him. Seán is no less intelligent or indeed opinionated because he has end-stage Alzheimer's than he was before his diagnosis. I believe that we as family carers have such an important role to act as advocates for our loved ones, but often we too are unaware of the rights and capacities that our loved one still has, or how we might exercise those rights on their behalf. And of course, if you do not know what rights you have, how do you know when they're not being upheld? And then, how do you know what you need to do about that? Family carers too need supported with training and information so that they can exercise those rights on behalf of their loved ones. It is a traumatic journey for everyone, and many are trying their best to love and care for their family members. But Seán and the Irish Dementia Working Group wanted so much more than that for people living with dementia in nursing homes. This paper is his legacy. I'm passionate on his behalf to ensure that it is widely disseminated, discussed, and implemented so that people living with dementia in nursing homes have the best life they can have, and that family carers who recognise their agency and can advocate on their behalf or support them to advocate for themselves, and informed carers who are well trained and who feel competent and confident to deliver a rights-based service, supporting people living with dementia cognitively as well as physically. People living with dementia absolutely have a right to good quality and safe services. And hopefully, in most cases, that is what's happening. But good quality and safe does not go far enough in terms of quality of life. They must be cared for by people who understand and are committed to delivering a rights-based approach to their care. And of course, they should also be supported to make complaints and speak out if their rights are impinged. The recommendations in this paper, if implemented, will be a big step in the right direction. Seán and other people living with dementia in nursing homes deserve nothing less. They can't advocate for the implementation of the recommendations, so we must do it for them. Thank you.
Thank you so much, Mary. That's a lovely legacy for Seán to have left behind.
Thank you.
So now I'm going to turn you over to Dr. Helen Rochford Brennan.
Good morning, everybody. Good morning, Mary. Thank you for that absolutely powerful and wonderful speech about our lovely Seán. I just want to remember Seán, but I also want to remember Judy, who was supposed to be speaking today and cannot be with us. And I want to say thanks to you, Kim, for inviting me today to speak and engaging all of the team with Engaging Dementia. I want to thank Saoirse and Claude for the Alzheimer's Society, and also I think my colleagues in the Irish Dementia Working Group. So for me, having this conversation about the adult safeguarding and people living with dementia in nursing homes paper created by Professor Sarah Donnelly, firstly, can I say that this issue is of the utmost importance to us, adult safeguarding and well-being of individuals living with dementia, either in nursing homes or in our communities. It is a topic that demands our attention, our empathy, and our collective action. As a society, it is our duty to protect and support the most vulnerable members, ensuring that their rights and dignity are upheld. Dementia affects a considerable number of people in Ireland, as I'm sure you've heard many times, an estimated 65,000 currently living with the condition. These individuals are often our parents, our friends, our grandparents, and they're confronted with a progressive decline in cognitive ability that impacts their daily lives and relationships. It is essential that we understand the unique challenges that we all face, that everybody understands their challenges, because they're not easy, and that we get the care and the provision of the appropriate care and the protection that we deserve. Therefore, this paper highlights or welcome the need for change. One of the fundamental principles we must embrace is the importance of adult safeguarding. Safeguarding is about what I'm mostly going to talk about today. It refers to the process of protecting individuals from the abuse, harm, and neglect. Unfortunately, adults with dementia are particularly susceptible to exploitation, mistreatment, neglect due to the decreased capacity to advocate for themselves. And when I say neglect and safeguarding, I just want us all to remember for a moment Claire Norland across the world in Australia. Where was safeguarding there? How did she have a knife? Why did the police need to be called? It breaks all of our hearts, those of us with dementia, to read those stories. Here in Ireland, we have made significant strides in establishing legal frameworks and policies to safeguard vulnerable adults, including those living with dementia. The Assisted Decision-Making Capacity Act 2015 was a significant milestone, emphasising the importance of respecting an individual's autonomy, whilst also ensuring their protection. This act emphasises the need to involve the person in decision-making relating to their own welfare, healthcare, and financial affairs, as long as they have the capacity to participate in the decision-making process. But they also have an opportunity to have decision-makers and a power of attorney to help them make their decisions. And the Decision Support Service is there to help them. It is also important to mention it truly matters having an advanced healthcare directive. It's good for our families, our supporters, to know how we want to live, if we want medical interventions, and how we would like to end our lives. The new Decision Support Service will certainly give comfort and support to people with dementia in making their decisions. However, legislation is not enough. We must foster a culture of awareness, empathy, and vigilance within our communities. It is essential that we educate ourselves about dementia, dispel myths and misconceptions, and promote an inclusive society that supports individuals with dementia and leading fulfilling lives. Carers and supporters, both informal and professional, play a vital role in the lives of people living with dementia. They are the unsung heroes who provide support, compassion, and assistance in navigating the challenges of daily living. As a society, we must recognise their dedication and ensure that they receive the necessary training, resources, and respite to conduct their invaluable work effectively. Additionally, collaboration between healthcare professionals, social workers, law enforcement, and community organisations is vital in the prevention, identification, and intervention of cases involving abuse, neglect, or exploitation. By working together, we can create a robust support network that empowers individuals with dementia and ensures their safety and well-being. The Irish Dementia Working Group, with the support of the Alzheimer's Society team, reviewed and collaborated with Dr. Donnelly on this paper. We had one-to-one interviews. We had focus groups. We held an online meeting with stakeholders, which were well attended, may I add. It included the National Dementia Office, Nursing Homes Ireland, HICWA, and other HSE representatives. We conveyed to them the importance of all stakeholders following the recommendations and hope HICWA will ensure this will happen. We plan on following up to offer guidance and assistance in implementing the recommendations. The Irish Dementia Working Group are deeply concerned about people living in nursing homes. On any given day, there are 32,000 people residing in nursing homes. As we do not have a registry, it is assumed the dementia prevalence rate is of 72% of residents. COVID certainly brought to our attention many concerns. We would like to shed a light on specific challenges faced by people with dementia residing in nursing homes, including the abuse of their safeguarding rights, the use of restraints, the lack of occupational therapy, our personhood, our citizenship, our agency, and our autonomy. Firstly, it is disheartening to acknowledge that abuse can occur within a nursing home setting, compromising the safety and dignity of residents, including those with dementia. Safeguarding rights are meant to protect vulnerable adults, but unfortunately, instances of abuse, neglect, and exploitation still occur. This can range from physical, emotional, or financial abuse to neglect practices that jeopardize the well-being of individuals. I would like to mention our census. If a person is no longer reading, it could simply be that they have not been seen by an optician. Or why is the TV so loud, which we all often experience in nursing homes? Is it the person has hearing difficulties? Sadly, they have not been referred to an audiologist. By not taking care of the person's senses is absolute neglect. We are aware the majority of nursing homes actively support and promote the human rights of people with dementia and strive to the highest standards in ensuring the safety and protection of all residents when harm, abuse, and neglect occurs. This paper has identified risk factors and policy gaps in the current safeguarding framework, which make it difficult to protect people with dementia in nursing homes. To combat these issues, it is essential to establish robust systems of accountability and oversight within the nursing home. This includes thorough staff training on dementia care, recognizing the signs of abuse, and promoting person-centered approaches that respect the autonomy and rights of residents. Additionally, protocols for reporting and investigating incidents must be in place, ensuring swift action and appropriate consequences for perpetrators. So I'd like to remind you all of recommendation number 9 in the paper. We believe that people living with dementia in nursing homes, regardless of their age, should be cared for by nursing homes that uphold and protect the human rights of people living with dementia, the promotion and embracing of the freedom principles, including explicit monitoring of this by HICWA as part of their inspection role and brief. Freedom principles have been used to indicate how human rights laws should apply to people living with dementia. These principles focus on fairness, respect, equality, identity, dignity, and autonomy. HICWA 2019. Everyone needs to be aware of these principles. And may I repeat that? Everyone needs to be aware of these principles. Another concerning issue is the use of restraints in nursing homes. Restraints such as physical restraints, I have seen them myself, or chemical sedation may be employed with the intention of protecting individuals or managing their behavior. However, antipsychotic medicine should always be a last resort due to the potential negative impact on a person's well-being and autonomy. Restraints can lead to physical and psychological harm, decreased mobility, and increased feelings of frustration and helplessness. To address this issue, nursing homes should adopt person-centered approaches that prioritize non-pharmacological interventions and alternative strategies to manage challenging behaviors. Creating a supportive and stimulating environment, providing specialized training for staff, and employing occupational therapists can greatly reduce the need for restraints and promote a higher quality of life for individuals with dementia. Restraint is an abuse of our human rights. We must also remember the consequences of resident abuse. As I'm sure many of you know, this happens, which has been associated with increased risk of depression, anxiety, and loneliness. Furthermore, the lack of occupational therapy in care homes, we hear it over and over, poses a significant barrier to the well-being and independence of residents with dementia. Occupational therapy is a vital component of dementia care, focusing on and enable individuals to engage in meaningful activities, maintain functional abilities, and enhance their overall qualities of life. It supports, excuse me, cognitive, physical, and emotional well-being, promoting autonomy and social engagement. To address this issue, it is crucial to integrate occupational therapy services within care homes. Occupational therapists can assess individuals' needs, develop tailored interventions, and collaborate with staff to create activity programs that promote cognitive stimulation and physical exercise and social interactions. And social interactions over and over, we hear, is the most important thing we can have. By incorporating into occupational therapy, we can enhance the overall care provided to individuals with dementia, empowering them to maintain their independence and dignity. I would like to bring your attention to recommendation 14 in the paper. We believe that people living with dementia in nursing homes, regardless of their age, should be actively supported to maintain all hobbies and pastimes that they can enjoy and receive adequate stimulation, including supporting attendance at community-based daycare centres if desired. How many people do we hear going out to daycare centres? Let's think about it. Cognitive stimulation and daily activities should be readily available in all nursing homes. The COVID-19, as Mary said, pandemic had a profound impact on our society, affecting various aspects of our lives. One area that has experienced significant challenges and at times heartbreaking consequences is nursing homes. Sadly, amidst the chaos and urgency of the pandemic, the rights and well-being of people in these facilities have been forgotten, leaving a profound impact on their lives. Nursing home residents, particularly the elderly and those living with dementia, have faced immense vulnerability during this unprecedented time. The measures implemented to curb the spread of the virus, such as restrictions on visitation and physical distancing, having inadvertently led to social isolation, loneliness, and a decline in mental well-being for the residents. These individuals have been cut off from their loved ones, their support system, and the meaningful connections that enrich their lives. Just remember, looking in the window. I had to do that. I know what it's like. I've lived through it. Moreover, the strain on healthcare systems has sometimes resulted in a lack of resources and personnel in nursing homes. This has led to challenging in providing adequate care, support, and attention to residents, exacerbating pre-existing issues, and highlighting feelings of neglect. Basic human rights such as dignity, privacy, and quality of life have been compromised in the face of overwhelming circumstances. In some instances, the impact of COVID-19, as I said, has been devastating, with outbreaks occurring within nursing homes, and people have been brought from hospitals to nursing homes with the virus, and resulting in a significant loss of lives. The combination of the highly contagious virus and vulnerability of elderly population has created an environment where the rights and well-being of residents have been tragically overlooked. This has underscored the urgent need for improved infection control measures, enhanced staffing levels, and increased access to healthcare resources within the nursing homes. And I want to reiterate again, enhanced staffing levels. As we move forward, it is imperative that we learn from the lessons of this pandemic and take decisive action to rectify the neglect and shortcomings experienced by nursing homes. We must advocate for comprehensive policies that prioritize the rights and well-being of these individuals, ensuring their voices are heard and the needs are met. This includes revisiting visitation policies to strike a balance between infection control and maintaining meaningful collections. It involves investing in robust infection prevention and control protocols, along with the adequate staffing, as I have said, to ensure residents receive the care and attention they deserve. It also means promoting person-centered care, respecting individuals' preferences, and upholding the dignity and autonomy of nursing home residents. So recommendation 11 of the paper states, we believe that people living with dementia in nursing homes, regardless of their age, have the right to private and family life, including looking after their own personal belongings and finances in a way that takes account of the will and preference of the person. This should also include the right to regular visits from family members. And I want to reiterate here, this is no longer about best practice. Thank God that went out the window a few weeks ago. This is about our will and preference. I would also like to highlight recommendation 17. People living with dementia in nursing homes, regardless of their age, should have a right to material citizenship and be encouraged and facilitated to bring personal belongings and functional objects of importance to the nursing home so they can live a meaningful life. The nursing home is now the person's new home, and we must ensure everything possible is done to assist the person living with dementia to adjust. We cannot forget the impact, as I said, of COVID-19, and we must actively work to address any challenges that they have endured. It's our duty as a society, as always, to preserve the rights and well-being of individuals, and should never be forgotten or compromised, even in the face of unprecedented circumstances. So let us commit ourselves to building a future where nursing home residents are valued, supported, and cared for, and their rights are at the forefront. Lastly, I call upon each and every one of you to challenge the stigma associated with dementia. Let us foster an environment where individuals living with dementia are treated with respect, dignity, and understanding. By creating a society that embraces diversity and champions the right of all its members, we can assure that no person with dementia feels isolated, marginalised, or forgotten. In conclusion, safeguarding the well-being of adults living with dementia is not just a legal obligation, it is a moral imperative. As a group of people living with dementia, please join hands with us and pledge our commitment to protecting and supporting individuals with dementia, ensuring they can live their lives with dignity, respect, and the freedom to participate in decisions that affect them. Together, we can build an inclusive society that cherishes and safeguards the right of all its members, upholding the human rights of people with dementia. As their condition progresses, is skilled work together, but we can ensure they are upheld. The Irish Dementia Working Group feel we must address the many specific challenges faced by individuals with dementia residing in nursing homes, as Dr. Donnelly highlighted in recommendations 22, some of which I have highlighted already today. I would urge you all to read this paper. It will be up on the website pretty soon of the Alzheimer's Society. Reviewing this paper was a challenge. It raised many different emotions, and I can tell you, it raised many different emotions for all of us in the working group, as we feel there is nowhere like our own home with home care support, like I have myself from the Alzheimer's Society, and Erin is here with me today. We put our emotions on hold and we got on with the job of reviewing it. Thank you to the Alzheimer's Society for their support, to the Irish Dementia Working Group for the resilience, and Dr. Sarah Donnelly for producing this impactful document. And thank you all for listening, and I do hope you will read this paper.
Thank you so much, Helen. So powerful as usual. A question has come in. What is the title of the paper?
The title of the paper is Adults Safeguarding and People Living with Dementia in Irish Nursing Homes.
Fantastic. And that's going to be published soon. It'll be available on the
website.
Yeah. Wonderful. Great. So thank you so much, both to you, Mary, and also to you, Helen, for a really powerful way to start the day. Something that needs a lot of attention in Ireland.